Good morning, everybody. We'll call the Public Presentation Committee meeting to order. This meeting will be conducted in person and via conference call in accordance with the Municipal Government Act, Section 199. Council chambers is open to members of the public while continuing to use telecommuting processes in place. To join the Public Presentation Committee meeting, please see the numbers available on the agenda on our website. We do have two presentations today, and we'll get started with our first one. We have representatives from the Drumheller Area Health Foundation regarding their Grow Your Own Rural Nursing Program and Simulation Lab. Good morning and welcome. I'll just have you push the button on the microphone.
Reef-link, just a procedure point that just approve the agenda. Yeah.
My apologies, just one moment. Do we have any additions or changes to our Public Presentation Committee agenda? If not, a motion to approve.
Also move.
Thank you, Councillor Bigger. Any questions or discussion? All in favor? Motion is carried. Now we'll move to your presentation.
Good morning, Council. On behalf of the board of the Drumheller Area Health Foundation, we would like to thank you for allowing us time to present this to you this morning. My name is Ashley and I'm the admin for the Drumheller Area Health Foundation. And with me today is Jackie Watts, the secretary to the board and counselor for Sartland County, and Mary Marshman, the treasurer of the board, and also representative for Wheatland County area. So in March of this year, AHS approached the board with an exciting program aimed at addressing critical nursing shortages in rural Alberta. The program is called the Grow Your Own program. It's a rural nursing program, and it will require a simulation lab to be built to work in tandem with this program. So it's a partnership between Alberta Health Services and the University of Calgary. It will allow rural residents within 100 kilometers of the Drumheller area to receive their Bachelor of Science in Nursing at the Drumheller Health Centre. And a lot of it will be done online as well. And the second year of instruction will take place at the Drumheller Hospital. Requires a simulation lab to be built at the hospital for instruction, and students mainly will be using the hospital simulation lab, combining online learning and some in-person labs infrequently at the campus at the University of Calgary. The course duration can be condensed from the traditional four-year program to 3.25 to 3.5. This program can help reduce financial and family barriers to attending university in urban locations, as most undergraduate programs normally require. So an overview of the Grow Your Own programs. In the Central Zone, there are two already, and we will be the third one to roll out. They have cohorts of 8 to 9 students per term. Again, the partnership is with Alberta Health Services and UFC. And the online lectures mostly, and then starting in year 2 on, there'll be in-person labs and clinical at the Drumheller Healthcare Centre. And the main aim of this program, again, is to reduce nursing shortages in rural areas by training local residents to become nurses that ensures they stay and work in the area that they were trained in. So for Drayton Valley and Wainwright, the selection pool, it was 120 kilometers. Because of our proximity to Calgary, our selection area is 100 kilometers roughly from the Drumheller area. So Wainwright was the first one to do this program. They started in 2021. They had their first round of graduates this year, and Drayton Valleys will start this fall. And so what the Drumheller simulation program will look like. It will need staff, personnel, space, program evaluation, equipment, curriculum, and faculty development. The simulation, these are just a couple pictures of at Red Deer Hospital in Lac La Biche, just to kind of show what their simulation spaces look like. They'll be equipped with everything to care for patients in a long-term setting or acute emergency style settings. So for our space, AHS proposed 3 different schematics, and they settled on the one that was most cost effective to do at our health center. So right down from the cafeteria, that's outlined in blue. 2 of the meeting rooms will be condensed into one. We'll have 2 beds with 2 mannequins, storage area, cleanup area, and on the end there will be a control room where the course administrators will sit and look into the simulations for the students. And across the room there in the yellow will be the debriefing room, which will go over the results of the simulation with the students. So where we fit into this is AHS had approached us to fundraise for the creation and retrofitting of the simulation lab at the hospital. The quote, with the separate conference room for the debriefing and a student lounge, is to be at a maximum of $300,000. The simulation lab equipment, about $60,000 to $80,000 of equipment, will be provided by the University of Calgary. Alberta Health Services will see to the maintenance, repair, and replacement of all this equipment in the lab. So I'll just go over some of the benefits for the Grow Your Own and the simulation, what it can do for our communities. It has a rural community focus. It's designed specifically for students living in rural Alberta, making this education more plausible and accessible than traditional university programs. It has blended learning, and it utilizes a hybrid approach combining online learning modules, in-person practical training, and clinical placements in their local healthcare facilities. Partnerships, again, U of C and AHS. So it'll reduce barriers to accessing education for the residents, such as travel and cost of housing, by offering the program in the local community. Local retention, by training nurses within their own communities, it increases the likelihood that they will stay on site after graduation. And although the terms aren't finalized to my knowledge yet, they will have to sign a contract to reside in one of the local areas within the 100-kilometer selection area after graduation. So the main aim, again, addressing nursing shortages in rural Alberta. It'll improve healthcare access by retaining nurses in these areas, and it'll improve the services for all the residents. Community development fosters a sense of community, encouraging local residents to pursue healthcare careers normally that they might not have access to without this program. And benefits of a simulation lab: enhance clinical skills. The simulations provide a safe space to practice procedures, refine their skills, and gain proficiency in a controlled environment, ultimately improving patient safety and outcomes. Improved teamwork and communication allows teams to practice their roles, communicate effectively, and coordinate actions, leading to better outcomes and patient care as well. Increased confidence for the staff, providing the safe environment to practice and learn. They will help build their confidence in their abilities, reducing anxiety and improving performance in real-life scenarios. Reduced errors and improve patient safety. They can help staff identify and correct potential issues in the care process or environment, improving the risk of errors and this overall safety to the patients. Support for specific groups. The simulation labs can be tailored to support staff returning from absences, transitioning to new roles, and seeking professional development opportunities. It's cost-effective training can be used to train staff more effectively than traditional methods, potentially reducing the time and costs associated with traditional training programs, a lot of which they would have to be sent away for, that they could now do in this space. Interprofessional education can facilitate collaboration, allowing staff from different disciplines to work together and improve teamwork. And the biggest selling feature for us in our areas, I think, is it's a powerful community resource. When this program isn't being used by the students of the program, it can be booked by any first responders in the 100-kilometer catchment zone. And also, when it's not being used by the first responders or the students, any of the education departments in those areas, their hospitals can book time at the simulation lab to use for their staff as well. So in summary, we as a foundation really support this program, as does AHS and our healthcare center. The creation, again, of this lab will be $300,000. It's due by early 2027. It is a substantial amount of money to raise in this time frame, given that we have to be cognizant to bring donor funds in for all of the other departments in the hospital and keep fundraising for the regular requests that come through at our board meetings. There is potential naming possibilities based on level of donor support. Local, municipal, corporate donor support will really help this program become a reality for our areas, and it'll impact our town and the overall quality of healthcare that the residents can receive. So we're coming to any of the areas, municipalities, and the towns in hopes of maybe securing a $10,000 grant from each in the selection area, or whatever the budget would have to grant. If not, we're just really thankful that you allowed us the time to come here and spread awareness about this program. I've left my business card here. They're accepting applicants for this program in October of this year. So if anyone knows of anyone that might be interested in the program, you can get in touch with me and I'll get you in touch with the appropriate people at AHS for that. We're very grateful for you guys letting us come here today, and we think this will really benefit not only the applicants, but also the residents in all of our areas. And some other fundraising steps we're going to be taking. We're working with some local realtors to try to get collection boxes at the tills, the rounding up or add $1 to your total. Grants from municipalities and towns, approaching corporate entities and for funding naming opportunities, partnering with restaurants to donate certain percentage on a given day, and targeted fundraising letters for smaller hamlets and villages within the selection area. Does anybody have any questions? I'm a bit of a motor mouth, yeah, sorry.
Thank you for your presentation. Does anybody have any questions? Councillor Eckert and then Councillor Lowerson.
Just on the, if a citizen wanted to make a donation, can you write are you available to a tax deductible receipt?
Of course, yes.
Okay,
Yeah,
perfect.
for sure. If it was just made out to the Health Foundation and just as a note that it was to go towards this program, we would happily get you a tax receipt right away.
Thank you very much. I thank you.
Thank you.
Councillor Lowerson.
So I think this is a good thing. I would certainly support it, but have you given this presentation to other municipalities and what's the reception been like?
You are our third, and the reception when the first one was really good. There was some concerns in the second one, which I think we've worked with the hospital and the site manager to address a lot of those. I do realize when we're on the edge of the selection zones, places like Settler that are closer to an urban center in Red Deer, but I think this will still be advantageous for them because it will cut down on the amount of travel and housing costs as they can do a lot of online learning. So that was kind of the only valid concerns we ran into, but I think
Right.
we've addressed them.
Okay, thank you.
Thank you for the presentation. Really interesting. I see the fundraising is for building it. I always concerned about operations after it's been up and running. Is there costs involved in running it? How do you get that?
I did ask the site manager, I said, is this initial investment all that's expected of the foundation? And that's why I made sure with the equipment that we weren't going to be on the hook for any of that afterwards or any problems with, the degrading of the actual space and that kind of thing. And I've been told that we will not be on the hook for that going forward. That will be AHS. They just needed the budget to actually build the space and then it would fall under their jurisdiction.
And further with first responders and stuff being able to utilize that in the future, would there be a charge in it? It sounds like probably not.
No.
Okay. Yeah. Great. Thank you.
Thank you.
And that's quite common with the foundation's model for you to provide the capital funding for equipment and then for the AHS to do the maintenance and the
Right.
those
And it is
operational
nice.
expenses.
They are going to provide the equipment in this case, the UFC will too. So that takes a little heat off for the fundraising.
Any other questions? Councillor Kester.
Yeah, I really like this program. And 100 kilometers, I haven't got a map in front of me, but I think that pretty well takes in at least 30 or 3/4 of Wheatland County, I would think. Has anyone ever looked at it?
I do have, I actually don't have it on this presentation, but if it's outside, there are areas, if they're closer to Calgary, that they won't accept applications. But if they're still closer to the Drumheller Healthcare Center and outside of that 100-kilometer zone, they will consider their applications as well. We did run into that at the Settler presentation.
So if you are within the 100-kilometer zone and closer to Calgary, would you be accepted in Drum?
Likely not if you're closer, from talking to the site manager, if you're closer to Calgary than to Drumheller, because the group is so small, 8 to 9 applicants, they would expect that they would be better off commuting to Calgary than commuting to Drumheller. So they likely would not accept those applications. But if they were outside of the 100-kilometer selection zone and closer to Drumheller, they would definitely look at them.
So I see your application date or the date you would like the donations is in 2027.
Well, that's when we're going to be due to pay.
Okay.
As early 2027. I think there might be a little flexibility if we're having a hard time coming up with it, but so far there's been a pretty positive response.
Okay, startup date.
Startup date. So startup date will be next fall. So 2026 in September, and accepting applications of October this year. And the simulation part of the program won't be till year 2. So that'll be 2027. Yes. Yeah.
That makes sense.
Yeah. So the first year will just be mostly online.
Okay, thanks.
Yeah, of course.
Any other questions? I want to thank you for your presentation. This is a really exciting initiative, and I think it's not only creating that opportunity for local residents who are interested in pursuing a healthcare career and removing some of those barriers for that, but the simulation lab will also strengthen rural healthcare through all of the mechanisms that you outlined. So I'm very excited, grateful for the work that the foundation does, incredibly grateful for our representatives and all of the people involved in the foundation and all of the people that support the foundation. This committee doesn't make funding decisions, but we can pass a motion to bring this back to council for consideration. And then the other thing we can do is use some of our communication channels to amplify your messaging. So if you have sort of graphic, like a one-page graphic or some advertising materials, if you can get in touch with our administration, we have some social media channels and connector newsletter that we send out, and different streams of communication, so we can hopefully increase that private support as well. And then also, if you have a briefing, we could send to some of our generous corporate sponsors as well, just so that they're aware of the project and they can consider it as well.
That's amazing. We really appreciate that. Thank you.
Well, we appreciate you taking the time to come and present to the committee and for bringing this to our attention. I had a chance to meet some participants and faculty from the Wainwright program, and it was incredible just hearing how by removing those barriers, they were able to access this education program and then be lifelong nurses in their community. So it's really exciting.
Great. Well, thank you again so much for having us. We
Thank
appreciate
you.
it.
We'll now move, as long as the representatives are ready, we will move to our presentation by Badlands Search and Rescue Association. Oh, yeah. Thank you, Shannon. Motion to accept the presentation. And I don't know if we also want to just direct administration to amplify communications for the foundation, as well as to bring it back to council prior to the budget, final budget decisions for consideration.
You would have to do that at the next council meeting.
Okay. Yep. So we can't direct from the committee to.
Yeah, that's correct. So we just have to be done at the next council meeting.
Okay.
We can add that on the agenda for the second, though.
Yeah, that'd be perfect. So just a motion to accept. Wonderful.
Also move.
Thank you, Councillor LaPrice. Any questions or discussion? I'll call the question. All in favor? Motion is carried.
Morning. Thank you for the opportunity for us to speak with you today. I'm Alan Ranger, Vice President of Badlands Search and Rescue Association. My compatriot is Elise Brown. She's Secretary of the association. Again, thank you very much for the opportunity. I'll turn it over here to Elise.
So we have a slide presentation for you this morning. I'll provide some narrative with each one of the slides, and then any questions you have, if we don't have the answers right away. We were hoping our treasurer could also attend with us today, but he was unavailable. So if there are any questions, I will get you the answers in a timely manner if we don't have them. Badlands Search and Rescue Association is a volunteer, not-for-profit, non-charitable organization that readily responds when called upon by tasking agencies, which include law enforcement, governmental groups, or other search and rescue teams. We search for hikers, campers, hunters, children, skiers, people with cognitive impairments, as well as any others that may be deemed to be lost, overdue, and/or injured. Law enforcement agencies occasionally request our assistance to search for evidence in incidents they are investigating. In times of disasters, natural or otherwise, we have members trained in disaster response and can provide emergency assistance. Our team participates in multi-jurisdictional mock sessions in search and rescue, as well as disaster response. These are only a few examples of the critical tasks we regularly train our members to be prepared to respond at any given time for ground search and rescue operations. Our 20-person team is a member of Search and Rescue Alberta and is trained in accordance with the provincial standards. We have a volunteer board of directors that ensures all guidelines are being met with regards to fiscal responsibility, training requirements, and logistics of acquiring equipment and assets for effective use in the field. Our territory ranges east of Chestermere to west of Bassano, north of the Bow River to Three Hills, Trochu, Drumheller, Hanna, and Clooney communities. It is stationed mainly out of Wheatland County and covers most of the Badlands classified areas of Alberta. Since its inception in 2011, Badlands Search and Rescue Association has been gifted with an initial donation of 2 command posts with pull vehicles, and 1 of each is no longer in usable condition, leaving only 1 set in operation. Volunteer members each provide their own personal gear during searches, which costs approximately $1,000 or more at their own expense. These kits enable each member to be self-sufficient out of doors in all seasonal elements, 24 to 72 hours. Our annual fundraising efforts through grants and activities provide some of the necessary small equipment needs for the association to utilize and covers most of our operational costs. Currently, both our 2005 Ford truck and command post trailer will soon be in need of replacement. The truck is used to carry necessary emergency equipment and pull the command post trailer to locations needed for search and rescue operations. Above and beyond our $20,000 annual operational costs, our association needs to accumulate funds in excess of $100,000 in order to purchase a new primary vehicle and command post trailer. We are in a financial position to fund 45% of the vehicle and are still in need of a significant amount of the required funding. Failure to replace these essential pieces of equipment will severely impact our ability to respond when needed. Our association continues to approach companies operating within our territory to consider corporate donations. We host fundraising events throughout the year in support of our financial needs. Recent applications for community assistance grants with Wheatland County, Town of Strathmore, and Town of Drumheller for assistance with this project have been declined. It has been suggested to our organization that this funding is outside the scope of grants and we should approach municipal and county councils. Therefore, we stand before you today asking that you present this to your county council to consider including our need in your capital budget items for 2026. As representatives of Badlands Search and Rescue Association, and on behalf of our board of directors, we appreciate the opportunity to present to you today and for considering our request.
Thank you very much.
Questions would we be able to answer for you, if any?
Any questions for the representatives?
You mentioned that you've had that truck and trailer have to be replaced. Like, is there a sort of a budget number that is gonna have to be raised?
The total cost of the replacement for the vehicle and the command post, we estimate in the neighborhood of $100,000. As Elise mentioned, we currently have about 45% of that cost.
Can you give tax receipts also as a foundation?
Yes.
Any other questions? Councillor Larson?
Have you done this presentation other places and what's been the response, or are we your first?
You're our first.
Okay.
We have a date scheduled with Drumheller early October, and Strathmere's getting back to me. It'll be between late September, early November.
Okay, thank you.
So you probably heard the comments earlier. Public Participation Committee does not make funding decisions, but it's our mechanism for getting this information to council. And then we can bring consideration for the funding request to a future council meeting. And similarly to the Health Foundation, we can also use some of our communication channels to help. I know we've done some in the past, I think, around volunteers for the search and rescue organization. So that's a mechanism as well to increase awareness about the work that you do and your need for funding. So if private community members would like to make donations, we can help raise awareness around that as well.
Very much appreciated.
Thank you very much. We appreciate you presenting. And if we have any follow-up questions, we'll reach out as well.
Certainly. And
Thank you.
we're certainly open to returning either to this committee or to council.
Wonderful. Thank you so much. Oh, of course.
So you had the truck and the trailer as equipment. Is there any other equipment? Like I was thinking more, do you have a boat? Can you do water rescue?
Currently, we do not. We currently do not have members trained in water rescue. It's a unique skill set that requires additional training. And while that is something that we have our sights set on in the future, we're not quite there yet.
Okay, thank you.
We did have application for one of our members for swift water rescue for 2025, but they only had limited spots available. So they had to pick and choose from the near 40 search and rescue units within Alberta. Our number was not one of them this year, but we will continue to apply. We also have drone units, and in our search and rescue operations, we have 2 separate litter patient carriers.
Councillor Kester.
You mentioned you have 2 units. How often do you deploy 2 units at the same time?
So we had 2.
Okay.
Yes, one. We only have 1 operation currently.
Historically, we are called out in the neighborhood of 2 to 3 times a year in our area. One of our struggles is in communicating with our tasking agencies, in making them aware of what we have to offer and encouraging them to make use of us. As we develop the relationships with the RCMP and our other tasking agencies, we anticipate our number of call-outs to increase.
Within the last 18 months, we've had 2 call-outs specifically from the RCMP. And on each of those, it's been a different set of officers that have reported back to their detachment commanders that our services are invaluable. They had no idea that we could do what we did for them.
Glad to hear that.
You're a relatively young search and rescue organization, like in the Alberta scheme of organizations. So there's a lot of opportunity for that increased awareness of the skill set that you bring in and the way that you can contribute to these very critical times. So
one of the other contributing factors to our level of call-outs, we took a huge hit during COVID in terms of our members. At one point, we could not field an operational team. We were down that low. We've begun to build up since COVID. As Elise mentioned, we now have 20 operational members, which is incredible. And that allows us to be much more responsive than we have been able to in the past. All of our members are volunteers. They hold jobs. They care for family members. They're not always available when called upon. And that impacts our response as well. They are dedicated. They do make use of their free time, devoting that to training and to the call-outs. But again, we are a volunteer organization. We're not paid for any of this. And we have to rely on members' generosity of their time.
any other questions? And just on that note, thank you for the commitment that you've made, both in the governance role, but also I'm assuming that you also are operational members, and please thank all of your volunteers. It's a tremendous commitment, and it's like fire service, like it's not necessarily extremely frequently required, but it's in the most dire situations when it is required. And so please convey our thanks to each of your members. I know the commitment is far more in terms of training and readiness, being ready and available for when those calls do come. So thank you.
Very much.
Thank you. Thank you for your time. Appreciate it.
Thank you. Motion to accept for information. Councillor Larson,
I'll move to accept their report as information.
thank you. Any questions or discussion? Call the question. All in favor? Motion is carried. That brings us to the conclusion of our public participation meeting agenda. Let's reconvene at 10:40. Is that work for people? For a committee of the whole? Meeting is adjourned. Thank you, everybody.